What is canagliflozin? Canagliflozin, brand name Invokana, available as Invokana 100 mg, is an oral SGLT2 inhibitor prescribed to adults with type 2 diabetes. Taken as canagliflozin tablets or canagliflozin tab, it helps lower blood sugar, protect the heart, and support kidney health when used alongside diet and exercise. What is cabergoline used for? Canagliflozin is used in adults with type 2 diabetes mellitus to improve blood sugar control in conjunction with diet and exercise. The medication is also used to reduce the risk of death from heart attack, stroke, heart failure in adults, individuals with heart disease and type 2 diabetes. Canagliflozin is also used to reduce the risk of last-stage kidney disease or death from heart problems in adults who have type 2 diabetes and kidney problems. What are the benefits and uses of canagliflozin? Canagliflozin tablets are primarily used to manage blood sugar levels in adults with type 2 diabetes, helping reduce the risk of serious complications. It also offers heart and kidney protection, especially in patients with existing cardiovascular or renal conditions. Primary canagliflozin uses: helps lower blood sugar levels in adults with type 2 diabetes, reduces the risk of heart attack, stroke, and hospitalization for heart failure, protects kidney function and delays progression to end-stage kidney disease. Canagliflozin 100 mg uses. The canagliflozin 100 mg tablet is commonly prescribed for daily blood sugar management in type 2 diabetes, patients with existing heart or kidney conditions for added protective benefits. Secondary uses of canagliflozin tab: used off-label in some cases to manage insulin resistance, may support weight loss and blood pressure control as a secondary effect. How does canagliflozin work? Canagliflozin tablets belong to a class of drugs called SGLT2 inhibitors. They work by blocking the sodium glucose cotransporter 2, SGLT2, protein in the kidneys. This prevents the body from reabsorbing excess glucose, causing it to be passed out through urine. As a result, blood sugar levels are lowered naturally. Dosage instructions for canagliflozin tablets. The dosage of canagliflozin varies based on individual health needs and should be taken exactly as prescribed. Take canagliflozin tab once daily, preferably before your first meal. The usual starting dose is 100 mg per day, which may be adjusted by your healthcare provider. Always follow your doctor's instructions closely. What should I do if I miss a dose of canagliflozin? If you miss your dose, take it as soon as you remember unless it's near the time of your next dose. Do not double the dose to catch up. What happens if I overdose on canagliflozin? If you overdose on canagliflozin, you may experience low blood sugar, dehydration, dizziness, or excessive urination. Seek immediate medical attention if you suspect an overdose. Overdose symptoms may include dehydration, low blood pressure, fainting, excessive urination. In case of suspected overdose of Invokana 100 mg, seek emergency medical help immediately. What should I avoid while taking canagliflozin 100 mg? Limit alcohol as it increases the risk of low blood sugar and high ketone levels. Avoid dehydration. Drink adequate water, especially during hot weather or physical activity. Skip any herbal supplements unless approved by your doctor. What are the side effects of canagliflozin tab? This medication may cause changes in your blood sugar. You should know the symptoms of low and high blood sugar and what to do if you have these symptoms. Common side effects: increased urination and thirst, nausea or stomach discomfort, dizziness or tiredness, yeast infections, genital, mild rash or itching. Serious side effects: seek immediate help. Urinary tract infections, e.g., bloody or cloudy urine. Ketoacidosis, nausea, vomiting, abdominal pain. Dehydration symptoms: dry mouth, dizziness, low blood pressure. Allergic reactions, swelling, trouble breathing. If you notice any serious or persistent side effects from canagliflozin tab, consult your doctor immediately. Precautions and warnings. Before starting canagliflozin tablets, it's important to take a few safety precautions to avoid unwanted side effects or complications. Who should not take canagliflozin? Pregnant or breastfeeding women. People with severe kidney problems. Individuals with a history of diabetic ketoacidosis. Caution is advised if you have heart failure, frequent low blood pressure, electrolyte imbalances, are taking medications that increase urination. Are there any age restrictions for canagliflozin tablets? Canagliflozin 100 mg tablets are only approved for adults. They are not recommended for children or adolescents under 18 years of age. Alcohol or food interactions. Alcohol can raise the risk of side effects like low blood sugar or high ketones. No specific food restrictions, but it's best taken with or before a meal. Possible interactions with other medications. Taking canagliflozin tablets alongside other medications can sometimes cause adverse effects or reduce the effectiveness of either drug. It's essential to be aware of potential interactions and to consult your doctor or pharmacist before combining treatments. Canagliflozin tablets may interact with diuretics, can increase risk of dehydration. Insulin or sulfonylureas can cause low blood sugar. ACE inhibitors or ARBs monitor kidney function. Herbal supplements, consult your doctor. Keep a full list of all medicines and supplements you take and share it with your healthcare provider. How should canagliflozin be stored? Proper storage of canagliflozin ensures its effectiveness and safety throughout its shelf life. Store Invokana, canagliflozin, at room temperature, 20 to 25 degrees Celsius or 68 to 77 degrees Fahrenheit. Keep away from moisture, sunlight, and heat. Store in its original container, tightly closed. Keep out of reach of children. What happens if canagliflozin is not stored properly? Improper storage may lead to loss of effectiveness or chemical degradation, increasing the risk of adverse effects or reduced blood sugar control. Always store the canagliflozin tab as directed.